Have you ever wondered why a medication you've taken safely for years suddenly starts causing problems? The surprising part is, the medication may not have changed at all. Your body did, and after the age of 60, that change becomes much more important than most people realize. Many people assume that once a prescription is working, they can continue taking it exactly the same way for the rest of their lives. Sometimes that's true, but sometimes your body quietly changes. Your kidneys filter more slowly. Your liver processes medications differently. Your muscles lose water. Body fat distribution changes. Even the way your heart and blood vessels respond to medicine isn't the same as it was 20 years ago. Here's why this matters. A dose that was perfectly appropriate at age 45 may affect you very differently at age 70, not because the medication suddenly became dangerous, but because the person taking it changed. That's why many healthcare professionals recommend regular medication reviews for older adults. Not to remove medicines unnecessarily, but to make sure every medication is still providing more benefit than risk. Today we're going to explore 7 medication mistakes that become increasingly important after the age of 60. These aren't rare mistakes. Millions of people make them every day. Some involve prescription medications. Others involve over-the-counter medicines that many people don't even think twice about. Most importantly, every one of these mistakes is preventable, and by the end of this video, you'll know the questions to ask your healthcare provider that could help keep your medications working safely and effectively. Before we begin, I want to make something very clear. This video is not telling you to stop taking any medication. Many medications save lives. Others prevent serious complications. The purpose of this video is education. Never stop, start, or change a prescription medication without speaking to your doctor, pharmacist, or another qualified healthcare professional. With that said, let's begin with the biggest misconception of all. Imagine placing the same amount of water into 2 different sponges. One is brand new, the other has been sitting in the sun for years. Even though the amount of water is identical, the 2 sponges absorb it differently. The human body works in a surprisingly similar way. As we grow older, our internal chemistry changes. Many people think aging only affects wrinkles or grey hair. In reality, some of the most important changes happen where we can't see them. Your kidneys, which help remove many medications from your bloodstream, gradually become less efficient. Your liver, which breaks down countless medicines, may process certain drugs more slowly. Body composition also changes. Many adults gradually lose muscle mass while body fat increases. Why does that matter? Because different medications are stored in different tissues. Some remain in body fat longer, others distribute differently. When muscle mass decreases, the result? The same medication may stay in your body longer than it once did. Sometimes that's perfectly fine. Sometimes it means the medication builds up gradually, over days or weeks. That's why medication management becomes increasingly individualized after age 60. Here's another important idea. Very few adults over 60 take only one medication. Many people take medication for blood pressure. Perhaps cholesterol, maybe diabetes, sometimes arthritis, occasionally heartburn, seasonal allergies, sleep difficulties, a vitamin, a supplement. One medicine becomes 3, 3 becomes 6. Then someone catches a cold and purchases an over-the-counter medicine without realizing it may interact with everything else. This is where things become surprisingly complicated. Every medication has its own effects, but medications can also influence each other. Sometimes one medication strengthens another. Sometimes one weakens another. Sometimes they compete for the same metabolic pathways inside the liver. Other times they affect blood pressure, heart rate, kidney function, or electrolyte balance at the same time. This doesn't automatically mean combinations are unsafe. Many people safely take several medications under proper medical supervision. The important point is awareness. The more medications involved, the more valuable regular medication reviews become. Let's begin with one of the most common misconceptions. If a medication is available without a prescription, many people naturally assume it's harmless. Unfortunately, that's not always true. Over-the-counter medicines are effective precisely because they have biological effects. Pain relievers, cold medicines, sleep aids, allergy medications, acid reducers. They work because they change something inside the body. The question isn't whether they're good or bad. The question is whether they're appropriate for your particular health situation. Take cold medications as an example. Many combination products contain several active ingredients in one tablet: a decongestant, a pain reliever, a cough suppressant, an antihistamine. Someone with high blood pressure may unknowingly take a product containing ingredients that temporarily increase blood pressure or heart rate. Someone else may already be taking another medicine containing the exact same pain reliever. Without realizing it, they accidentally double the dose. That's why reading labels becomes more important with age, whenever possible. Keep an updated medication list. Include prescriptions, over-the-counter medicines, vitamins, minerals, herbal supplements. Bring that list to every medical appointment. Many medication problems are identified simply because someone took the time to review everything together. Here's something many people overlook. Your pharmacist knows an enormous amount about medication safety. They're trained to recognize drug interactions, duplicate medications, appropriate timing, potential side effects, and dosing concerns. If you're unsure whether two medications can be taken together, ask. If you're buying a new over-the-counter product, ask. If you begin taking a supplement, ask. These conversations often take only a few minutes, but they can prevent significant problems. Many serious medication problems don't begin dramatically. They begin quietly. A little dizziness, slight fatigue, dry mouth, mild swelling in the ankles, occasional confusion, a little more sleepiness than usual. Many people assume, "I'm just getting older." Sometimes that's true, sometimes it isn't. Certain medication side effects appear gradually. Because they develop slowly, they're easy to ignore. Here's the challenge. Small side effects sometimes become larger ones. Feeling slightly dizzy increases fall risk. Persistent fatigue may reduce physical activity. Less movement affects muscle strength. Reduced strength increases fall risk again. Everything becomes connected. That's why it's important to tell your healthcare provider about changes, even if they seem minor. Don't wait until the next annual appointment. If something clearly feels different after beginning a medication or changing a dose, here's something I'd encourage everyone watching to do. Once or twice each year, schedule what many healthcare providers call a medication review. Bring every medication, every vitamin, every supplement, every herbal product. Ask 4 simple questions. Do I still need this? Is this still the best dose? Could anything interact? Is there anything I should stop taking? Those 4 questions alone have helped many older adults simplify their medication routine while improving safety. I'd like to ask you something. How many medications do you currently take every day? 1, 3, 5, more than 10? Leave only the number in the comments below. It's always interesting to see how different everyone's situation is. And if you're learning something valuable today, please consider subscribing to Smart Health Daily. Every week we share practical, science-based health information designed to help you stay healthier, longer. We've talked about why medications affect the body differently after 60, why over-the-counter medicines deserve more attention, and why small side effects shouldn't be ignored. But now we're going deeper. Because in Part 2, we'll explore one of the biggest medication mistakes older adults make. Why more isn't always better. How dehydration changes. Medication effects. The surprising role of supplements, and several habits that can quietly increase your risk without you ever realizing it. You won't want to miss what's coming next. Now let's continue with another medication mistake that becomes increasingly important after the age of 60. And this one surprises almost everyone, because it doesn't involve taking the wrong medicine. It involves taking the right medicine the wrong way. Picture this. It's breakfast. You grab a glass of water, then you swallow 6, 7, maybe even 8 pills together. It feels efficient. Everything is done for the day. But your body doesn't necessarily see it that way. Different medications are absorbed at different speeds. Some work best with food, others work better on an empty stomach. Certain medications compete for absorption. Others can reduce the effectiveness of vitamins and minerals when taken together. For example, some thyroid medications should generally be taken well before calcium or iron supplements, because these minerals can interfere with absorption. Some osteoporosis medications require a completely empty stomach and remaining upright afterward. Certain antibiotics may interact with dairy products or mineral supplements. This doesn't mean you need a complicated schedule. It simply means your medication routine should match the specific instructions provided by your healthcare professional. One simple adjustment in timing can sometimes improve how well a medication works without changing the medication itself. Another common mistake is taking medications at different times every day. One morning at 6, the next at 10, then forgetting until bedtime. Some medications continue working even if timing varies slightly. Others depend on consistent blood levels. Blood pressure medicines, certain diabetes medications, some heart medications. These often work best when taken consistently. Think of it like watering a garden. Small, regular watering keeps plants healthy. Flooding them one day and forgetting the next usually doesn't produce the same result. Creating a routine helps. Take medications alongside an established habit. After brushing your teeth. With breakfast, after dinner. Use a pill organizer if recommended. Set phone reminders. Small systems reduce mistakes. Earlier we talked about hydration. Now let's look at it from a medication perspective. Water does much more than satisfy thirst. It helps transport medications, supports kidney function, maintains healthy blood volume, and helps your body eliminate certain medicines after they've done their job. When hydration decreases, medication concentrations can become less predictable. Some medicines may have a stronger effect, others may increase the risk of side effects. This becomes particularly important during hot weather. After vomiting or diarrhea, or any time fluid intake decreases. Many older adults don't notice dehydration until symptoms appear. They may feel unusually tired, lightheaded, confused, or notice darker urine. These symptoms are easy to mistake for just getting older. Sometimes they're simply signs that the body needs more fluids. Here's something many people overlook. Imagine you're taking medication exactly as prescribed. Then you catch the flu. You lose your appetite. You drink much less than usual. Perhaps you're sweating from a fever. Suddenly, your body's chemistry changes. Some medications may need temporary adjustment during certain illnesses. This is one reason healthcare providers often recommend contacting their office when significant vomiting, diarrhea, or dehydration develops, especially for people taking medications that affect blood pressure, kidney function, or blood sugar. Never make those changes on your own. but do recognize that illness can temporarily change how your body responds. Let's talk about something many people never mention during medical appointments: supplements, fish oil, turmeric, garlic, ginkgo, vitamin E, magnesium, St. John's wort, herbal sleep products. Natural doesn't automatically mean harmless. Many supplements have biological effects. That's exactly why people take them. Some may influence blood clotting, others may affect blood pressure. Some interact with prescription medications by changing how they're absorbed or metabolized. For example, certain herbal supplements may reduce the effectiveness of prescription medications. Others may increase the chance of bleeding when combined with blood-thinning medicines. Again, this doesn't mean supplements are bad. Many people use them safely. The important point is communication. Tell your doctor. Tell your pharmacist. Write supplements on your medication list, just like prescriptions. Complete information leads to better decisions. There's another misconception worth discussing. Many people assume if one supplement is good, 3 must be even better. Unfortunately, nutrition doesn't usually work that way. Your body needs balance. Excessive amounts of certain vitamins or minerals may create problems rather than benefits. That's one reason many experts recommend focusing first on a balanced diet, then discussing supplements with your healthcare provider based on your personal needs. Certain medications require periodic monitoring, not because they're unsafe, because they need to be used safely. Blood tests may help monitor kidney function, liver function, electrolytes, blood sugar, vitamin levels, blood counts, thyroid function. These tests help your healthcare provider determine whether medications continue working appropriately. Think of them as routine maintenance. Just as you wouldn't drive a car for years without checking the engine, your body benefits from occasional checkups too. Here's something interesting. Many adults gradually lose weight as they age, sometimes intentionally, sometimes unintentionally. Losing even 10 or 15 pounds can occasionally influence how certain medications affect the body. Body composition changes too. Less muscle, different fat distribution, reduced kidney function. All these factors contribute to how medications behave. That's another reason medication reviews should happen periodically rather than only when something goes wrong. This may seem obvious. Yet it happens surprisingly often. A spouse has similar symptoms. A neighbor recommends a leftover prescription. Someone offers a pain medication after surgery. Avoid this. The medication that's appropriate for one person may be completely inappropriate for another, even if symptoms appear similar. Age, kidney function, other medications, allergies, underlying conditions, everything matters. Medicines are individualized. Before taking any new medication, ask yourself 4 questions. Do I understand why I'm taking it? Do I know how to take it correctly? Do I know the most important possible side effects? Do all my healthcare providers know I'm taking it? If you can answer yes to all 4, you're already reducing unnecessary risk. So far, we've covered several medication mistakes that often become more important with age. Assuming over-the-counter medicines are automatically harmless. Ignoring subtle side effects. Taking everything together without considering timing. Poor hydration. Forgetting to mention supplements. Skipping medication reviews. Sharing prescriptions. These aren't dramatic mistakes, they're everyday habits. And everyday habits often have the greatest long-term impact. We've talked about how medications enter the body, how they're absorbed, and how they interact. But now we're reaching what may be the most important section of this entire video. Because in part 3, we'll explore the warning signs that should never be ignored. The medications people most commonly misunderstand after 60, how to prepare for every doctor's appointment. and the simple questions that can help you protect both your heart and your overall health for years to come. Stay with me. The final section brings everything together. We've talked about how your body changes after 60, why medication timing matters, why hydration is more important than many people realize, and why even vitamins and supplements deserve attention. Now let's discuss something that may be even more valuable, knowing when your body is trying to tell you something isn't right. Because medications rarely cause serious problems without giving at least a few subtle warning signs first. The challenge is, many people dismiss those signs as just getting older. Sometimes they're not. Imagine your car suddenly begins making a strange noise. You probably wouldn't turn the radio louder and ignore it. You'd want to know what's happening before the problem becomes more serious. Your body works the same way. It often sends quiet signals before larger problems develop. The question is, are we listening? Some medication-related warning signs can be surprisingly subtle. Feeling unusually dizzy when standing up, new swelling in your ankles or feet, unexpected bruising, changes in your heartbeat, persistent fatigue that wasn't there before, confusion, new balance problems, unexplained shortness of breath, frequent falls, sudden changes in blood pressure readings. None of these automatically mean a medication is responsible. Many medical conditions can cause similar symptoms, but they are worth discussing with your healthcare provider, especially if they begin after starting a new medication or changing a dose. Many people think, my appointment is only 3 months away. I'll mention it then. Sometimes that's reasonable, sometimes it isn't. If a new symptom is persistent, unexpected, or getting worse, it's usually better to contact your healthcare provider sooner rather than later. Early adjustments are often much simpler than treating problems that have continued for weeks or months. Now let's discuss another mistake that deserves serious attention. Stopping medications without medical guidance. This happens more often than many people realize. Someone reads an article online. A friend shares a frightening story. A television program mentions side effects. The next morning, the medication is gone, unfortunately. Some medications should never be stopped suddenly unless a healthcare professional specifically instructs you to do so. Certain blood pressure medications, heart medicines, steroids, some anxiety medications, some antidepressants. Stopping them abruptly may cause significant health problems. Sometimes symptoms return quickly. Sometimes blood pressure rises sharply. Sometimes withdrawal symptoms appear. Sometimes the body simply needs time to adjust. That's why medication changes should always involve professional guidance whenever possible. The safest approach isn't fear, it's communication. If I could recommend only one habit to adults over 60, this would probably be it. Review every medication regularly, not just prescriptions. Everything. Think about how life changes over 10 years. Weight changes, blood pressure changes, kidney function changes, medical conditions change, new medications are added. Others may no longer be necessary, yet surprisingly, many medication lists remain almost identical year after year. Sometimes because everything is still appropriate, other times simply because nobody stopped to ask. A medication review isn't about removing medicines, it's about optimization, making sure every medication still has a clear purpose, still provides benefit, still matches your current health, still works well with everything else you're taking. At your next appointment, consider asking these 4 questions. Question number 1. Do I still need every medication on this list? Sometimes the answer is yes. Sometimes treatment goals have changed. Sometimes healthier lifestyle habits have reduced the need for certain medications. The important thing is asking. Question number 2. Is this still the right dose for my age and current health? Remember, your body changes. Kidney function, weight, other medications. Everything influences dosing decisions. Question number 3. Are there any interactions I should know about? Include prescription medicines, over-the-counter medicines, vitamins, minerals, herbal supplements. Everything counts. Question number 4. What symptoms should make me contact you immediately? Knowing what to watch for gives you confidence. Instead of worrying unnecessarily, you'll understand which symptoms deserve prompt attention. Here's a simple idea that many healthcare professionals appreciate. Keep an updated medication record. It can be on paper, in your phone, or in a medical app. Include medication names, dosages, when you take them, why you take them, known allergies, emergency contacts, healthcare providers, supplements. This becomes incredibly valuable during emergencies, hospital visits, travel coverage, or appointments with new specialists. You don't have to remember everything. Your list remembers for you. One of the biggest misconceptions in healthcare is that medications work independently from lifestyle. They don't. Healthy habits often improve how medications perform. For example, a balanced diet supports overall cardiovascular health. Regular physical activity helps maintain circulation. Quality sleep supports recovery. Managing stress contributes to healthier blood pressure. Avoiding tobacco benefits nearly every organ system. Limiting excessive alcohol intake may reduce medication interactions for some individuals. Think of medication as one tool. Lifestyle provides the foundation that helps those tools work effectively. The two should support each other, not compete. Medicine continues evolving. Recommendations change. New evidence emerges. Treatments improve. That's actually good news. It means healthcare continues learning. Something recommended 15 years ago may have been considered the best available evidence at that time. Today, new studies sometimes lead to updated recommendations. That's one reason ongoing conversations with healthcare professionals remain so valuable. Healthcare isn't static. Neither are you. Let's step back for a moment. Today's message isn't that medications are dangerous. Far from it. Many medications prevent heart attacks, reduce strokes, control diabetes, treat infections, relieve pain, improve quality of life. The goal is simply making sure they continue working safely as your body changes. Knowledge creates confidence. Confidence leads to better questions. Better questions often lead to better care. Today we discussed why medication safety changes after age 60. We learned that your body processes medications differently as you age. Over-the-counter medicines deserve the same respect as prescriptions. Timing matters. Hydration matters. Supplements matter. Small side effects shouldn't be ignored. Regular medication reviews may help identify opportunities to improve safety. And perhaps most importantly, your medication plan should evolve as you do. Growing older doesn't automatically mean taking more medications. Sometimes it means using existing medications more thoughtfully. Sometimes it means adjusting doses. Sometimes it means asking questions that haven't been asked in years. Remember this: the safest medication isn't always the newest one or the strongest one. It's the medication that's appropriate for your body, at your stage of life, used in the right way. That's what truly matters. Before you leave, I'd love to hear from you. How many medications do you currently take each day? And when was the last time you had a complete medication review with your doctor or pharmacist? Share your answer in the comments below. Your experience might encourage someone else to schedule an important conversation about their own medications. If you found today's video helpful, please take a moment to like this video, subscribe to Smart Health Daily, and turn on notifications so you never miss our weekly evidence-based health videos. Our mission is simple: to help you understand your body, make informed health decisions, and enjoy a longer, healthier, more independent life. Thank you so much for watching. Stay informed, stay proactive, take good care of yourself, and we'll see you in the next video.